The latest on the pandemic, many hospitals across the country are at a breaking point. More than 95% of ICU beds are occupied at 1 in 4 hospitals nationwide, according to the New York Times. Omar Villafranca is in hard-hit Memphis, Tennessee. Omar, good morning.
Good morning. Here's a stat for you. Tennessee leads the nation in the number of new COVID cases per capita. That's according to the CDC. And one of the reasons why is the low vaccination rate amongst kids. For children between the ages of 12 and 17, fewer than 1 in 4 have been vaccinated. And as the doctors at LeBonner Children's Hospital can tell you, that's having very devastating effects.
Most 17-year-olds do not request to go to a doctor, which should have been my first red flag.
It was late July when Julie McDivitt's son, Jacob Rodriguez, started feeling sick.
I felt like I had COVID, felt really tired, headache, couldn't taste nothing. It was awful.
Even after a positive test, McDivitt expected her son, a passionate high school football player, to run right over COVID. And for a little while, he did.
When did it change?
So day 2, fever hits, and it never let up. 14 days straight, he ran fever.
Finally, McDivitt got Jacob into LeBonner Children's Hospital in Memphis.
The nurse comes in, and he's like, looks like Jacob's played 4 quarters of football with no pads on the inside of his body.
When you hear that from a medical professional, what are you thinking?
Truthfully, God, where are you taking us with this? You know, am I going to be on that list of numbers? Is my kid going to be one of those numbers?
Jacob had developed severe inflammation from MIS-C, a rare and potentially fatal condition related to COVID-19. And for 4 days, he and his mother sat together in a hospital room. Jacob slowly improved. But over the course of those 4 days, LeBonner went from treating 5 pediatric COVID patients to 21. Within a few weeks, it peaked at 33 patients. At least 3 children died during the month of August.
We had a perfect storm, the vaccination rate, the Delta variant, and school starting back.
Dr. Nick Highsmith is medical director of infection prevention at LeBonner.
Not only is it devastating to see a child in that situation, but to know that the majority of this to this point is preventable is also devastating.
We didn't wear a mask like probably should have been.
Was he vaccinated?
He was not.
Were you vaccinated?
I'm not.
But Jacob's bout with the virus has changed things. McDivitt says she's got plans to see her doctor about the shot.
Are you closer?
I'm getting it. I just have some questions first.
People were just coming up to me like every class period, like, what'd you go through? It's no joke. And I was telling them about it, like, take this more serious or you could probably end up like how I ended up.
Jacob lost 20 pounds, and that's a big deal for a young football player. And he also missed a few games of his senior year, but we want to show you some video. He made it back onto the field. That was him on Friday, actually running out there with his teammates. He told us he does want to get the shot. And after everything he went through, Gayle, he told us that some of his teammates even got vaccinated after seeing him in the hospital.
I do like hearing that. I'm sorry they had to go through that to get the message, but glad Jacob's going to be okay. Thank you, Omar. Thank you very much.